Uterine fibroids are benign, non-cancerous growths that occur within the uterus. They're basically little balls of smooth muscle that can grow, and they can range from being pretty small in size, and they can become very large.
Up to 200,000 women are diagnosed each year with uterine fibroids. Many, many more women have fibroids if they're not diagnosed, if they're not symptomatic. But the women who do have symptoms, they usually will complain of pelvic pain or pressure, low back pain, heavy menstrual bleeding, prolonged periods, painful sexual intercourse. Some women will complain of difficult conception. Some women will complain of fatigue due to anemia. Those are the most common symptoms that we see. If the symptoms get much worse and the fibroids enlarge, some women get frequent urination and constipation as well.
Fibroids are most common in women between the ages of 18 and 45, women who have not been pregnant, if there's a family history of fibroids, and most commonly in the African American population. Fibroids nearly impact 2/3 of women by the age of 50 years old.
There aren't too many complications that can occur. One thing that happens occasionally if the fibroids are on the inside of the uterine lining, those are called submucosal fibroids, that can make it harder for a woman to conceive. Another complication that's more frequent that I see in my practice is women who have prolonged heavy bleeding can actually become anemic, and that really will affect their lifestyle where they're very fatigued and lethargic throughout the day. They may even need a blood transfusion.
Fibroids can be diagnosed on physical exam. It's possible that when a woman sees her gynecologist, that gynecologist could physically feel the fibroids. But they're typically diagnosed on imaging. And there's two forms of imaging that are most useful for diagnosing fibroids. The first are ultrasounds. Pelvic ultrasounds are very common. But some of the limitations with pelvic ultrasounds include the fact that the ultrasound probe is looking from the inside, and it's not possible to get a global look at the uterus. Overlying bowel gas can make visualization of fibroids a little difficult. And as such, as an interventional radiologist, we actually recommend MRIs for our patients. With MRIs, we can get a global look at the uterus, we can see exactly where the fibroids are, we can see the blood supply going to the fibroids, and it could really allow us to direct a woman towards the appropriate form of treatment.
Complications with fibroid include severe anemia, whether it's acute blood loss or chronic blood loss, chronic pelvic pain and pressure. There are loss of work days related to the menstrual bleeding, which can happen for more than 7 days. Women have a lot of mental issues when it comes to their bleeding with work and their everyday lives.
Only symptomatic fibroids need to be treated. As we mentioned previously, many women may have fibroids and have no symptoms. They do not need to be treated because they are not cancerous tumors. If the tumors do enlarge and cause other problems, like we mentioned, chronic pain, heavy bleeding, other issues, then we recommend treatment for those fibroids.
Typically, women are offered hysterectomies, and that seems to be a pretty severe option. And it's actually one of the most commonly performed surgeries in the United States. And now, for women who still choose to have kids and are in childbearing years, typically what's been done is a myomectomy, which is a procedure where an incision is made in an abdomen, and what a gynecologist can do is they can remove either a whole fibroid or part of a fibroid. Now, both myomectomy and hysterectomy are surgical treatments, and they are invasive, and they require significant recovery. Now, a minimally invasive treatment option is possible, and that's one that we provide as interventional radiologists that many women don't hear about, and that's called uterine fibroid embolization. It's a minimally invasive treatment that could be done through a pinhole either in the wrist or in the groin, and it basically involves the injection of small, tiny little spears into the arteries that go to the fibroids. And what this results in the fibroid shrinking in size and becoming softer. So ultimately, this helps significantly with bleeding, pain, and other symptoms.
Recovery from UFE, things that patients need to know. The technical success rate for doing the procedure is greater than 98%. The cure or treatment is ranging from 75 to 90%. Most women, they notice their bleeding has subsided after 2 cycles of their menstruation. The bulky symptoms, they improve the most within 3 months, but the fibroids continue to shrink throughout the year. Post-procedure pain cannot be predicted about the location or number of fibroids. Women can expect to get back to normal living within 1 to 2 weeks. Post-procedure pain is managed with non-steroidal anti-inflammatory medications like Motrin, steroids, a short brief term of narcotic medication, and antibiotics. I perform my uterine artery embolizations from the wrist artery, which is much more comfortable for patients so they can get up much earlier and curl up in their beds if they need to, as opposed to doing the procedure from the common femoral artery or the groin artery.